Schistosomiasis is a disease that has for long plagued humanity. To date, it is considered by the Centers of Disease Control and World Health Organization as the third most common neglected tropical disease, caused by a parasitic bug fluke that afflicts up to 207 million individuals worldwide. With large prevalence in Asia, South America, Africa, this disease lays claims to over 300,000 individuals annually. With such large prevalence, the disease appears to be growing in vectors and seems more and more dangerous with each passing day. Today, we will be traveling from our quaint town of McAllen to the deep waters of Nigeria, where we come face to face with death itself. Okay, so maybe not that scary, but this little fella here is known as the schistosoma and is the primary vector of schistosomiasis. But how does that work, you may ask? Well, let's find out. It all began with a worm. Well, not a worm exactly, but rather with an egg. And not this egg either, but rather this egg right here. After this egg is released, it then becomes a merisadia, where it travels into the soft tissues of freshwater snails such as these. While inside the snails, the mercadia matures into sporocysts, which is a germination stage for the parasite, which allows them to further mature into these. Now, these are called cercariae and are the final form of the parasite before it enters the bloodstream of humans. Well, not these humans exactly, although I do hear great ratings about this show, but rather these humans right here. While inside a human host, the cercariae migrate along the circulatory system to the portal blood in the liver, where they mature into full adults and mate, forming a paired worm, which migrate to the mesenteric vanules of the bowel or rectum and venous plexus of the bladder. Here, these worms shed eggs, which are later shed through stools or urine. Unfortunately, in places with poor water circulation, these contaminated stools and urine samples often wind up back in public drinking waters. Here, the transmission cycle for the vector begins anew and thus infecting more people. However, this disease is completely preventable, and through proper understanding of vectors that spread the disease, we can further educate our fellow individuals and thus prevent more additional spring up of cases of schistosomiasis. It came from outer space! Well, not really, but it did come from somewhere pretty kind of dark and sort of deep. Water. More specifically, it came from freshwater snails that often reside in large freshwater lakes located all throughout the country of Africa. Here, we'll notice the basic anatomy of the snail. As you can see, the biggest difference between a male and a female is obviously the penis sheath, with the majority of the characteristics of both being pretty similar: siphon, head, shell, foot, gills, and of course a lung sac. Now, due to the large presence of soft tissues located within the shell, as well as large amounts of space, the schistosoma parasite is easily capable of going in, setting up shop, and multiplying its numbers within the shell of the snail. Once large enough numbers exist, the cercariae are then able to venture outside of the shell and further infect more additional hosts. Now, although current research is partially lacking, we are led to understand that in individuals with sexually transmitted diseases, there is an increased number of schistosoma parasites within their bloodstreams, specifically urogenital schistosomiasis, leading to further speculation that there is a possibility of urogenital schistosomiasis being transmitted sexually from person to person. Now, mice have long since been regarded as spreaders of all sorts of diseases, from bubonic plague to just about any virus on the market currently, and there is no exception to schistosomiasis. In recent studies, schistosomiasis has actually been shown to be viable in West Nile virus and capable of fully living and reproducing viable eggs inside these mice. These mice then later secrete feces and urine into populated areas, exposing food and water sources to the schistosoma parasite, ergo infecting other individuals in the process. Unfortunately, due to recent discovery of Nile rats as a potential vector for schistosomiasis, further reports and research is lacking and will be further expanded upon with additional research and time. And so finally, we reach the final section of this video, which includes symptoms, severity, and current research examples of schistosomiasis. Current symptoms of schistosomiasis range from minor infections, which show symptoms of rash or itchy skin, usually days after the infection, as well as progressing into fever, chills, cough, and muscle aches further on during the infection. In children, exposure to the disease causes anemia, malnutrition, as well as learning defects. Additionally, years of infection can cause damage to the liver, intestine, spleen, lungs, or bladder due to the specific scarring that is brought on by unpassed eggs that remain inside these specific areas. Finally, chronic exposure to the disease can cause abdominal pain, enlarged liver, blood in the stool or urine, as well as problems passing urine. Additionally, chronic infection may also lead to increased risk of liver fibrosis or bladder cancer. Finally, if eggs are found in the spinal cord or the brain, this may lead to seizures, paralysis, or spinal cord inflammation, all of which may eventually lead and progress to death. Unfortunately, current treatment options are limited when affected with schistosomiasis, with the majority of the treatments being anti-parasitic medications. Additionally, education is a major component in assisting children as well as adults in recognizing the presence of this disease in their country. Current research shows promise in developing fields of understanding as well as controlling the spread of this disease throughout the country through the specific elimination of the snail vector that spreads the disease. Additionally, through more focused concentration on education, specifically in younger generations, the hope of scientists as well as other researchers is to prevent younger generations from contracting the disease, ergo giving them a better fighting chance in understanding and eventually eradicating this disease in their country.